All the others are in the percentage that we wait to see. But we'll talk later about this problem with CNS tumors. The results in both departments of Thessaloniki were very good, as you can see. The last, 3 decades before, you see that a good, very good overall survival in ALL, 50% at AML. The same, I'm going to do it fast with all these results. We had Hodgkin disease, very good results, 94.5 overall survival and 83 with non-Hodgkin lymphomas. But we had this problem. We have seen only less than 10% of CNS tumor that, as you know, are more than 25% in the population, the pediatric population. So we have a question to discuss later why we see this small number of tumors, of CNS tumors. I can go on very fast with renal tumors. Same thing, the right percentage and good overall survival, very good. Same thing with rhabdo. Sarcomas had a lower overall survival, about 55%. And I'm going on with germ cell, liver tumors, carcinoid tumors, and LCH. So they had also very good results. So I'm coming to our years in a way. I mean, from 2009 to 2023, from our unit in Achepa Hospital. You can see here that we had approximately 35 new cases per year, a total of 532 patients aged 1 to 16 years. Most of them were male, 46% solid tumors and 41% with hematological malignancies and 12.2 lymphomas, with an overall survival of 97% in lymphomas, 81 for leukemias, and 87 for solid tumors. Next slides, you can see all the cases of leukemias with ALL, AML, and a few cases with CML and HLH. So the overall survival is very good in ALL, but not so good in AML. Lymphomas they have a very good survival, and it's most about half Hodgkin and non-Hodgkin lymphomas. Here you can see all the solid tumors. You see the number of CNS tumors, who are just 63 from 532 total cancers in children. You see in the next slide that is about 13% of all tumors. And you can see all the other cancers in this slide. But we mainly want to show the CNS tumors and the overall survival. You can see mieloblastoma, astrocytoma, and ependymoma, and craniopharyngioma and glioma tumors that we have had. All the other tumors, you can see how many cases we had in these years, and you see here the overall survival, which is very good in most of the tumors. We have to say something about neuroblastoma, of high-risk neuroblastoma and sarcomas, that they have the worst prognosis. But the overall prognosis of all tumors is more than 80%, as we saw before. Radiation therapy from all these patients had received about 25% of the patients, a little bit more, and about 58% of all CNS tumors. And before I show you that, I would like to say again this problem with CNS tumors. The last 15 years we had a percentage of 13% of CNS tumors. So we need at least 15 cases per year more with CNS tumors. Why we miss these tumors? We don't know. They don't refer to pediatric oncologists. They go in other countries. They go abroad. They go to Athens. We have the problem of radiotherapy unit in northern Greece. So all these problems have to do mostly with brain tumors. And before I close this talk with statistics mostly, I hope that you will have the time to go to see a very beautiful museum nearby Thessaloniki. To Vergina is a very new museum, which is very beautiful, and you will see the royal tombs of Macedonia. If you have the time, I think that you should see that. Has very special things to see. Okay, thank you very much.
Your statistics from your department and in the first of your presentations of the whole Thessaloniki. I think that these statistics show how important it is to give radiation therapy to all patients, because in this way we have better results and better overall survival. And we hope that we will have in the future proton beam therapy in our city. Are there any questions from the audience? Okay, thank you very much, Dr. Just one more minute, please.
Yeah, here closes the session in this room, but I just wanted to remind you that in the main auditorium, Professor Roberto Orecchia and Arnold Campos are giving a presentation in the framework of the Aristotle Medical Forum in the session of the role of artificial intelligence in radiation therapy. So I encourage you to just step in the main auditorium. Thank you very much.